Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Waiting can be tough when it comes to your health care, but sometimes it's necessary to ensure that care is paid for. Prior authorization is an approval process that you go through before a certain test or procedure, but the insurance company doesn't always approve it. Joining me now is Sean Stack, a policy director at the Healthcare Financial Management Association. Sean, first of all, why is it that some tests, procedures, treatments require prior authorization and some don't?
Insurers use prior authorizations to verify that a service one of their members is requesting is medically necessary based on that member's condition or medical history.
Are there any common things that you generally will need prior authorization for?
Typically things, that are very high volume and cost a little bit more require prior authorizations. Radiology, imaging, lab tests, expensive lab tests, certain procedures that are diagnostic in nature might require prior authorization to make sure that the patient falls within those guidelines of receiving that test, that lab, or that procedure. So those are typical things that insurers have outlined prior authorization policies on.
Insurance companies don't always approve these. On average, I think about 6% of prior authorization requests are denied. If this happens to you, what's your next move?
In several scenarios, payers do tend to deny that initial request for prior authorization, and being prepared and the provider being prepared to be able to provide additional medical records or additional support to tell that payer why that procedure or that item is needed for that patient can rush that along, can expedite that approval.
The good news is insurance companies do approve about 82% of denials that get appealed. But don't forget, you'll still be responsible for your share of the cost. That's all for us today. I'm Erica Grotto with Hi-Fi Health News. Thanks for watching.